Hi everyone, I'm John White and I'm happy to present this year's Perennial Hero Award to Phyllis Greenberger for her inspiring career as a national leader in women's health, a highly regarded expert in policy analysis and advocacy, and her personal journey as a family caregiver and Alzheimer's disease research advocate. Phyllis started her career as a social worker when she had 3 children under the age of 6, while her husband Bob traveled the globe covering foreign policy for the Wall Street Journal. When she started working at the American Psychiatric Association, Phyllis noticed that they were doing nothing on women's mental health issues, and she promptly pointed it out. That's not surprising to any of you that know Phyllis. In 1993, Phyllis became the first president and CEO of the Society for Women's Health Research, a Washington, D.C.-based advocacy organization formed to improve the health of women through research. Under Phyllis's leadership, the Society was the driving force behind the NIH 1993 Revitalization Act, which directed the NIH to establish guidelines for inclusion of women and minorities in clinical research. It also provided guidance on reporting sex, racial, and ethnic differences in health outcomes for Phase 3 trials. After years of continued activism, in 2011, the NIH guidelines were expanded to include women in Phase 1 and 2, where safety, toxicity, and dosage are determined. And basic research was also finally added. It seems obvious now that of course women should be included, but not all researchers believed that, and Phyllis worked tirelessly to change their minds. Phyllis also persevered for years with a proposal to the Institute of Medicine to validate the concept of sex differences. In 2001, the Institute of Medicine released a groundbreaking report exploring the biological contributions to human health, Does Sex Matter?, that called on researchers to understand the implications of basic biological sex differences for the betterment of human health, men and women. I met Phyllis when I first came to DC in 1999 to work at the Centers for Medicare and Medicaid Services. I was tasked with staffing the newly created Medicare Coverage Advisory Committee with a public member. Phyllis's name came up. I interviewed her. I was impressed with her intelligence, her advocacy, and her wit. I selected her to be on the committee, and we've been friends ever since. While I was at FDA, Phyllis helped us create the Drug Trial Snapshots program to provide safety and effectiveness data by sex, age, race, and ethnicity of clinical participants for recently approved drugs. She insisted there be transparency, and it has made a monumental difference. Currently, Phyllis serves as HealthyWomen's Senior Vice President for Science and Health Policy, where she directs efforts to address women's unique health disparities across the healthcare continuum. As a family caregiver to her husband Bob, Phyllis has also become an advisor to the Alliance's Talk Nerdy program and Accelerate Cure and Treatments for Alzheimer's Disease Coalition. Phyllis, it's wonderful to be with you today, and I can think of no one more deserving of the Perennial Health Hero Award than you. Congratulations.
Thank you so much. That's quite an introduction. I really appreciate it, and I love the fact that you, as a friend of mine since 1999, are presenting it, and I want to thank Sue Peshin, the CEO of the Alliance for Aging Research, for giving me this award. And I love working with the Alliance, and I love the work that they're doing on ACT-AG to promote research in Alzheimer's for obvious reasons.
Well, we have this beautiful award,
yes,
but we're also in this beautiful room. We're in your home.
Thank you.
And I have to ask that everyone is wondering, tell us about this chair.
I should have looked it up before you got here, but it's called a Teddy Roosevelt chair, and and the horns obviously are real. And if you go online, there are lots of different configurations. And I just bought it because I thought it was interesting. Yeah. Right? You can sit on it. It's a little uncomfortable, but with the cushion there.
Okay. We'll try that later.
Okay, you could try that later.
But I want to ask you, you've worked on this issue of sex differences for nearly 40 years.
Yeah.
And what has the science changed? Has people's attitude changed? How did we finally come to this recognition that women may respond differently to drugs, devices, and other therapeutics. We typically thought of women, to be honest, as little men, and you changed that. So was it the science? Was it the attitude? How did it happen?
Well, it was the science, but there were instances where it was obvious or became obvious once people looked. One of the issues was a heart medication that resulted in heart failure for women that obviously did not have that effect on men. And then years later, there was research on Ambien and how it affected women differently. For many years, aside from the fact that they thought women and men were basically the same except for their reproductive organs, they also thought in terms of alcoholism or other issues that because women were smaller, that they would succumb, let's say, more quickly to being inebriated, when in fact it had more to do with metabolism, not to do with their size. And it also, of course, because of finally the noticeable differences in terms of the medications, people started taking notice. But I think what's interesting to me now in this day and time is that the COVID experience has really brought to the fore the importance not only of clinical trials and also an education in clinical trials, which at the time I started, and we did a video on it, asking people on the street what a clinical trial was, and nobody knew what one was. I think people know what a clinical trial is now. And I think I'm always sort of amused when I see that there's a difference between men and women and the vaccine works differently, and that Black women or Asian women have different responses. Right. And it just, it's, to me, it's sort of, great, finally we're here. But we still have a long way to go.
What are the issues that you see that are facing women as they age? What are those typical health issues that we haven't addressed enough?
Well, obviously heart issues. I mean, I remember that, this is hard to believe, but that I had meetings with the American Heart Association convincing them that women had heart disease. Do you remember the time when they advised men not to shovel snow because they would have a heart attack, but nobody said anything about women don't shovel the snow? I think cardiovascular, there are certain kinds of heart disease that affect women disproportionately from women, and the signs are difficult, and they're often misdiagnosed. Yeah. And then you still have a certain amount of, and this goes back centuries, of sort of women not being believed. Pain is another issue where men and women suffer pain differently, and women are pretty much brushed off, told that it's in their heads and go see a psychiatrist. So I think, but the more we learn, the more we know that there are differences, muscular differences. I was on a device board years ago also, when all hips and knees were all based on men's anatomy, and it didn't occur to people that women's hips and knees were different. So there was a lot.
It's a good point, because people didn't think about women when they were designing trials, designing devices, seeing the effect of drugs, and you helped change that. And it wasn't easy. I think we should acknowledge that. It seems obvious now that that's the case. So I want to ask you, what's your advice for young women that are coming into leadership roles?
Well, I think you have to really persevere, and you have to don't take no for an answer. I was really, don't ask me why, because I was known in my younger years as being kind of shy. I don't know.
I can't imagine you as shy.
No, I can't imagine either. I sort of came out of that, I guess. But there were a lot of instances. I mean, even at the APA, when I started working there as an intern, as part of my social work, I was only working there 3 days a week. And when an opening opened up, and I went to get the job, I remember being interviewed by the CEO, and he said, well, you're only here 3 days a week. And I said to him, I can do it in 3 days, but somebody else can do it in 5. And years later, he said to me, that's why he hired me. And then I know, I don't know if you spoke with the Institute of Medicine, that was also a real push. And then, of course, Congress. I mean, you just have to keep doing it. And it took a long time. And it's not over yet, as I said. I mean, there's still a lot that we don't know. There's still work to be done.
I've listed your professional career, but here we are in your home. We're surrounded by this beautiful artwork that you have created. There's a book on the coffee table that profiles you as an artist, not necessarily as a women's health research advocate. But you're also at a point in your life where you're serving as an advocate for your husband, as a caregiver. How has that changed your perspective about the need for advocacy and the need for research, particularly in Alzheimer's disease?
Well, obviously in Alzheimer's disease, you know, I'm nervous about my family. I think the spread of it, I mean, the good news is that we're all living longer, and the bad news is that because people are living longer, they're more prone to get Alzheimer's or other kinds of dementia. I'm concerned now with COVID and how it's affecting people's brains and what's that going to mean in the future. So I think there's a lot of things to be concerned about. And the painting, which is interesting, it takes my mind off it, off that, and just, I guess, other parts of my life. It's just, I find it's, because it's with you. I mean, my husband's with me all the time, and the hurt and the loneliness. But once I start painting, I can sort of compartmentalize and move that away. So, so I've been doing a lot of painting, and it turns out that someone that I know has recently started a gallery, and she came over to see my work. I said, "You don't have to do it. Don't have to be nice." And she said, "No, I want to." So I'm going to have an exhibit, and that'll be fun.
Well, Phyllis, congratulations again on the
Thank you so
Perennial
much.
Hero Award. As I said at the beginning, there is no one more deserving
Well,
than
I
you.
really appreciate it. Thank you so much, and thank you for the aging research, and thank you to Sue Peshin, and it's really been a pleasure. I hope to continue even into my older age. Thank you.